this legislation be able to participate in that fund? Nobody has been able to say. Why $7 billion? What will the requirements for qualification be for the money?
What about those people who settled?
All the settlement, that pays out first. Those are settlements for costs, and that's why we were able to reduce the size of the bill. We took this bill from $7.4 billion down to $6.2 billion because of that settlement, right. Because these first 11 9/11 responders can get it. That's what the CBO scores, the Congressional Budget Office. They look at the problem. They say there's possibly 100,000 people who could get very, very ill. How much would it cost to give them health care if they need it, and whatever costs would have to be paid out? And they estimated it to be this amount of money. But that being said, you know, we may not spend this amount of money. And what's really a terrible fact, which you have to understand, is these men and women are dying now. They are suffering. Right. We have a display in the rotunda in one of the Senate buildings of 29 NYPD police badges. These are men and women who have died since 9/11 from these cancers and terrible diseases. The average age of these men and women was 46. Right. So you can imagine the crippling effect this is having on their families, young children. These are men and women in the prime of their lives, dying because of the toxins. Which only underscores the question, why? Why didn't Congress help sooner? This is the lame duck Congress, and you still haven't been able to move to help these people. Well, I introduced the bill last year, and so I've been working on it for the last 2 years as the senator leading this bill. And we've had our hearing in the Senate, and I've been working with my colleagues to get a bill that they will be comfortable paying for. Simultaneously, they've been working very hard in the House. They had 21 hearings in the House. It passed out of all the committees of jurisdiction.
You guys had a supermajority. I mean, you control the White House, both houses of Congress with a supermajority, and yet you wait until the lame duck before you take action.
It's not a question of waiting. There's so many pressing issues. As you know, we've been working on the economy. The biggest, most important issue is how do you create jobs in New York State right now? So we passed a lot of bills that were essential for doing that. Lending for small businesses, tax cuts for small businesses and middle-class families. So we've had so many priorities. But this is one of my priorities and one of the priorities of New Yorkers. You ask any New Yorker, do you believe 9/11 heroes should have health care? You bet your bottom dollar they're going to say yes. And you know what's going to happen? We are going to have a Christmas miracle because people are going to come together, people of goodwill on both sides of the aisle, and they are going to stand up for first responders at the time that these men and women need our help more than ever.
Yeah. Does President Obama support this? Because Dick Durbin was saying today, quote, I hope the White House support it, but apparently the president has uttered not a word about this.
No, that's not true. He supports it fully, and he said publicly
because we researched it and couldn't find anything that he has said publicly about it.
He said live on television during the last Senate retreat when we had a Q&A session, I said, Mr. President, will you sign a 9/11 health bill that's fully paid for? And he said, yes, I will. So he supports this bill, and he's supported it from the very beginning. All
right. Senator Kirsten Gillibrand, I know this is so important to a great many New Yorkers and a great many Americans who admire the heroics of the 9/11 first responders. And is that in reference to your ribbon that you're wearing?
Yes, I'm going to wear this ribbon until we have our vote for our first responders.
And it will be this week, you believe?
Yes, it's as soon as we're done with the START treaty, ours is the next vote.
All right. Senator Kirsten Gillibrand, thank you very much for being with us, and good luck to you in this important endeavor.
Thank you so much.
Okay.